Breast cancer in women is on the rise, and doctors say alcohol use could be the reason why.
Reporter Meg Terrell sat down with an expert and a breast cancer survivor to learn more about the risk.
Every time I'd go to like the cancer centers, I was young. Like I was like by far, younger than everybody by like 20 or 30 years.
Alicia Korber found out after her first mammogram at age 44 that she had breast cancer.
Wow, how is this even possible? Like I'm healthy, I'm young, I take care of myself, I work out, I do all the things that you assume you're supposed to do.
Testing showed she had no elevated genetic risks for cancer, so Korber and her doctor discussed what environmental factors could play a role. He mentioned one that surprised her: alcohol.
I feel like alcohol is socially part of everyone's life. Going out with family, going out for dinner, when you're at home, like having a glass of wine when you cook, working in the city, and possibly going out for drinks after work with friends. When you're young, you don't think that that's something that could potentially, have a long-term effect on you when you're older.
Her doctor, Sam Nardello at Tufts, says Korber is not alone.
It's so socially acceptable to have a couple cocktails on the weekend, but we don't really attribute that to the real risk that it is.
A Surgeon General advisory in January sounded the alarm.
There is a causal link between alcohol and 7 types of cancer, including breast cancer and colon cancer. But what is also clear is that the majority of Americans do not know about this link between alcohol and cancer.
And data show women have been drinking more over the past few decades. Researchers say the trend is most evident in women with higher levels of education and could be driven by having kids later and by more marketing of alcohol to women. Doctors worry this could be leading to more cancer diagnoses. Breast cancer rates have been rising by 1% a year.
Over 250,000 women are diagnosed with breast cancer in the U.S., and that's too much. That's way too high. 44,000 of them, there's a direct correlation between alcohol and them developing the breast cancer.
Better detection could also be playing a role in rising breast cancer rates. Nardello notes it's not possible to know if alcohol is the direct cause of anyone's cancer, but he recommends cutting back.
What about if, you went to college in the 2000s and everybody was drinking a lot, and as a 40-year-old you're like, uh-oh, I should stop now. Does that help reduce your risk?
It does help reduce your risk. And that's nice to hear. There needs to be more research on what that is, but I'd say it's never too late.
The latest research suggests that risks for breast cancer rise even with 1 drink a day, the long-time recommended limit for women in the U.S. As a result of her diagnosis, Korber says she's made some big changes.
I know it's difficult when you're working and you've got, young kids, and you take your health and put it kind of to the back seat. And having, this conversation and hearing more about the Surgeon General's warning, I think ultimately consuming less alcohol, just makes a whole lot of sense.